Yeah, we've done some work related to the food labels and then what consumer perspective is about food labels. I know, as Mr. Sanya was saying, it's a very minuscule proportion which consumes, packaged food. But at the same time, I would also reiterate that even a single ingredient food like atta comes in a packed form these days. So you cannot rule it out. If there is, you're talking about things like chips and other things, if there's a 10 rupee pack available in urban areas, for rural areas there's a 2 rupee pack available, which you may not see in the urban market. Nevertheless, they are penetrating. That's one aspect that has to be looked at. And I know, the question that has been asked is in the context of the growing NCDs. The safety of food that we are talking about is not just the safety as we see in terms of the contaminants or microbes or whatever, but the safety in terms of the growing NCDs in the Indian context. And studies from NI, studies from elsewhere also show that NCDs are not anymore restricted only to the affluent classes or urban areas. NCDs are growing in poor environments. NCDs are more even in rural areas. So in that context, informed choices become very important. And I keep saying this in all the fora that I go to, that most literate people are nutritionally illiterate. When we did our studies related to food label information, we've done a series of 3 studies aided by WHO India again. And then in the first, we've seen how our regulation compares to those of the other countries and how our regulation has actually lived up to the context of health that is there in India. And in the second study, what we have done is we have done supermarket intercept surveys wherein we've seen what the consumers are seeing when they are buying packaged foods in 2 geographical regions, one city in north and one city in south. And in that, we've seen that if you just go by practices, 90% of the people claim they read labels. But when you go and assess what they're actually looking for, they're either seeing the brand name or they're seeing the manufacturing date, the best before date, or the expiration date. But all of them know that there is nutrition information and ingredient list that is there on the label, but they cannot read it or they don't understand. For instance, in a survey in a study that we are doing in Hyderabad about with the school children about encouraging them to read food labels so that they make informed choices. The school children, we were surprised that when we are talking about energy and the calories that they have to consume should be less. They were asking us why energy should be less. Energy should be more, because energy in local language translates to power or Shakti. Shakti is supposed to be more. These are simple things that consumers need. And apart from label reading, we also know that many studies prove that health risks or food safety risks emanate from home kitchens more than anywhere else. Indian context, home kitchens are most important. Unlike in the West, most of the processing happens in the Indian in kitchens. So what is happening? If we divide the practices of a householder into food safety related practices, food safety related awareness, and food safety related enabling environment, you will be surprised to see food safety related practices are very good. If you just go by the normative practice, it is very good. But if you just try and understand, simple thing like washing hands. It's common in our tradition, whichever caste, whichever religion, whichever region, whichever area we belong to, we wash our hands before we consume food. But this washing practice is tick when you just assess whether it is good or not. But you have to see whether the washing is right or not. The awareness is more about building the scientific rationale behind the practices that we are following. Why washing hands is important, how to wash hands. And simply, somebody was talking about cutting boards being clean. Cleaning them under water and then cleaning them thoroughly. And reheating the food that it's a common practice in Indian context to reheat food and consume. But what does reheating mean? Thorough reheating. So these are the areas where, India specific areas where awareness needs to be built among the consumers. But I'm not saying, consumers, I'm not raising myself on a higher pedestal and saying consumers do not know anything and they have to be told. Consumers know a lot of things. Perhaps we need to learn as communicators from the consumers as to what they already know and how they are ensuring the safe practices. And with the paucity of time, I'll just go for the next question that you asked about risk perception and risk communication. Risk communication needs to be strongly built into our system of food safety. and I'm sure FSSA is working towards it. While we talk about risk assessment, we don't talk about risk communication. Before we communicate risk, we need to assess what people perceive as risk. For instance, for a person who's driving, in a simple example, like a person who's driving a bike, you say you have to wear a helmet. Every hero thinks he is a hero and he drives bike very well. It is for somebody who cannot drive the bike well that he has to wear a. So until and unless I perceive that there is a risk for myself, I won't take a corrective measure. So in a small study that we've done in Hyderabad, what we've seen is people, we have lots of debate about GM foods and safety of GM foods. We have lots of debates about various things, pesticide residues and things like that. We've seen people do not know what GM foods are. People misunderstand GM foods to high-yielding varieties. People misunderstand these things to hybrids. Everything that is big, colorful and shiny is considered to be GM food. So there is a lot of disconnect between what consumers perceive as risk and what the actual risk is as per the scientific guidelines. I think we'll have to look into many of these issues and paucity of time, I can go on talking about this. Thanks so much.